I'm Josh with Waupaca Community Media, and we're here for our weekly Waupaca Community Update. Aaron Jensen, say Waupaca, and Ron Sari from the Waupaca School District once again with us. How are you doing, guys?
Terrific. Thanks, Josh.
Good, Josh. Good, thanks.
And we won't beat around the bush here. There's a big topic that just became apparent. I think it's been being discussed for a little bit, but really became apparent last night at the City Council meeting, and that is proposed mask ordinance or resolution. Aaron, what's going on with that?
Yeah, so one of our Alderman Keelan, brought it up as a discussion last night. We've been getting a lot of public input on both sides and leading up to it. Public input on questions on, does the city have the ability to put a mask ordinance in place? What does that look like? What could it look like? And should we? And that discussion was had at a council meeting last night for about a half an hour or a little longer. And we've received a lot of public input since last night's meeting, and I think that's fantastic. Probably opened my email inbox this morning and had about 70 emails, and we want to encourage people to continue to give your thoughts. That public input email address is just making sure I have this right, publicinput@cityofwaupaca.org. That automatically gets forwarded to myself. And in about 5 minutes after this interview, Josh will set something up so it also automatically gets forwarded to all elected officials. So just please know that people's voices will be seen and heard. And yeah, I think that's kind of where we're at. So Josh, just to recap kind of where we're going from here, we've talked about a lot of things. We talked about not doing an ordinance. We talked about doing an ordinance. We talked about a resolution and the differences between all of those things. And I think it's staff's job from here on out to just look into consequences, good and bad, on all of the options and present facts as we move forward, and just do our jobs in educating our council members so they can make the best decision possible. And we look forward to doing that, and we're starting that right away today. And like I said, we'll look forward to hearing everyone's opinion on this over the next couple of weeks. So
from a city standpoint, a mask ordinance being looked at on the school standpoint, you guys are in hours and hours of meetings each week. And the stat you gave me, Ron, between all the people involved with all the meetings on discussing what's next, 124 and a half hours a week total, people combined in meetings working on that, including your stakeholders, including the community, including your school board. Enlighten us how your process is going.
Enlighten you, hey? That's a neat way to put it. Well, yeah, on Monday we had a special board meeting and we shared with the board, the planning pieces that are going into all of these recommendations and the communications and the plans that we're rolling out. We initially, when all this COVID hit, we were meeting as a learning team daily. And right now we've gone to twice a week. So we're talking the administration, the principals, the directors, the nurses, for instance, meeting twice a week on Monday and Wednesdays from 8 to 10. There's 16 people on that team. And then after the fact, the court team meets every day except for Friday. And that's a 1.5 to 2 hour meeting as well, planning for those learning in 2020-21 meetings. Every Monday, I meet with the county superintendents and our Waupaca County health official, and that's at least an hour to an hour and a half, getting updates and working to try to be consistent within and between the county. Every Tuesday morning, I start the day with a legal meeting update with one of the premier legal counsels across the state. There's different law firms, education law firms that talk to us for an hour, and we can have questions and answers. The core team, we meet right after that, and I debrief with them on what we learned and how that impacts our planning and what we're doing. On Wednesdays, that's our second Learning 2021 team meeting in the week, getting ready for the Thursday stakeholder meeting. Thursday evening, we have a stakeholder meeting where we have parents and community members, a couple board members, teachers who kind of we get information from them on what our plans are, get their input, their perspectives, we answer questions. But going back to Wednesday, there's another, this one's a CISA 5 superintendent meeting. So it's not a Waupaca County Superintendent, it's a CISA 5 meeting. And it's either on a Wednesday late morning or a Thursday late morning. And then, of course, this meeting every week, the three of us sit down and have a little interview, which is great because it's another opportunity to share information and be transparent. That's a big part of our focus. So I talked about Thursday, we've got a core meeting, possible, if not Wednesday or Thursday, the CISA 5 meeting. And then I mentioned that stakeholder meeting at 5 o'clock every Thursday. Friday mornings, I start with Jed Wolt, our county health official, and Dr. Dory Happ, who is our doctor liaison that we're required to have. And so we discuss different scenarios, they answer questions. What was interesting and what was very exciting for me last Friday when we met, Jed and Dr. Happ both agreed and stated that if we were to start on Monday, that they would be telling us we need to be masked. All the staff and all the students masked. We've kind of crossed the threshold. And so when I look back on Friday and I look at the county website with the number of COVID positive cases, et cetera, at that point we had on a 7-day average 7 new positive cases per day. So to me, that kind of was a benchmark, you know, to understand, okay, we crossed that threshold. They're now telling us that's what we have to do. So the next threshold will be when do we are not able to be in person, because we're still planning in-person learning as we go back in the fall and September 1, where the high school would have to limit the secondaries from 7 through 12 would have to limit the number of students going in person. So there would be these A-B schedules, half the students going a certain amount of days in person, the other half are doing virtual, and then they flip. So we'll see what that benchmark is. And then the next one would be when they say all 7th through 12th grade have to be virtual. And the final benchmark will be when all K-12 has to be virtual. So nobody really knows what those benchmarks are, Josh. I cannot find a superintendent. I can't find a doctor, a county health official, a state health official, a governor. I can't find anybody saying these are the lines in the sand. But I do know, Josh, Jed is doing a good job in regards to communicating with us and sharing input. And when he told us that on Friday, it will also include with these future benchmarks, not only the number of COVID cases new per day over a 7 or 14-day period in our county, but it'll also take into account information from our individual schools across our county, you know, how many students or staff or family in quarantine or identified as positive. And then it'll also take into account the data they get from Theta Care, how many beds are occupied by people with COVID. Right now, what was told to me on Friday was most of this spike is coming from ages of 19 to 35. So that tells me, you know, it's the younger people. And I was told that also none of them have had to be hospitalized, which is good. And a majority, if not all of them, are experiencing very, very minor symptoms, which is good. So I would guess that our doctor liaison and our county health official are going to continue to monitor these. And if these continue to grow and maybe the age group switches and it's older people, or maybe the symptoms are more significant, and maybe if there's more people hospitalized, et cetera, that we'll be getting the guidance in the direction to say, now you have to do X, Y, or Z, you know. The hard part is we've been in this high category. There's 3 risk categories, low, medium, high. We've been in high since May. So it's July. So it's nice to know where those thresholds are.
I'm happy to hear you've got some health professionals on board and side by side working with you, and that you're being very data driven with the decisions you're making. And I know off the air we were kind of talking, no one really knows anything about what's going on with this. It's still so new and stuff's changing, and you know, everyone can do the best they can with what little information they have that is known. And you know, I at least from what I'm hearing, I'm happy to hear the school's approach on what you're doing.
Well, I appreciate that, Josh. The other thing I wanted to mention is, I don't know if I said this, but we're going to have a weekly special board meeting. This week, well, we had one Monday, we're going to have another one on Friday, just because we want our board to have access to the information that we're looking at and to get their feedback and input and hopefully blessing as well. But that could be at different days depending on the week, and I'd like to get it at a regular date and day of the week and time. But at Monday's board meeting, our board approved what Jed and Dr. Happ told us that we were going to do, which is our staff and students are going to be masked when we return at this point. And so what we're working through with Dr. Happ and Jed right now is when are those times when it would be appropriate for a student or a staff member to choose not to have a mask on. You know what I mean? Like here we are sitting in our office, our door is closed, I'm by myself. I think it would be appropriate if I don't have to have a mask on, for instance, you know, or if I'm a custodian and it's 10 at night, nobody else is in the building and I'm by myself and do I need to have a mask on, for instance? So we're working through these times that it's okay not to have a mask on, but anybody can wear a mask all the time if they want. And we also know we have special needs children who may not be able to wear a mask if they have sensory issues or maybe on the autism spectrum. So their IEPs will be guiding those situations. And we're going to have students and some staff who may not be able to wear a mask. Like if I had an underlying health condition that made where wearing a mask would hurt me medically or physically, there are some of those exceptions. So we have to use common sense and good judgment, even though we know we're going to be masked a great majority of the time. We talked about, you know, in a classroom, I know because I used to teach too, and it's difficult with children and sometimes young adults. They don't always follow the expectations and rules, and they push the limits and you know, little kids with runny noses and things. It's not, you're not going to be able to have it 100% where their masks are on. And we talked about the idea of having a mask break during the day where everybody's, you know, we're working hard to have the desks in every classroom be at least 6 feet apart as much as we possibly can. Teachers are removing unnecessary items like tables or other things so that we can get the space in all of our rooms. So if we're sitting 6 feet apart, just like we have a milk break, I think it might be okay if our medical liaison and our county health official deem that it's okay, maybe they can have a mask break, you know? So those are the things we're working through and getting everybody's input and perspective.
I know some of what you're talking about, you know, maybe not the exact stipulations are all the things that would go into a mask ordinance too. It's just how many little things come up. When do you really need it? When don't you? What about the exceptions? Someone who can't, and just so much, you know, when I heard the discussion at City Council last night, what you're talking about, there's just so much to consider on something like this.
Well, you know, I'm learning so much. What a blessing it is for me to be able to meet with our local health official 2 to 3 times a week. On top of that, with doctors like Dr. Happ, and getting their perspectives and understanding, not just from what I read, but that. And, you know, we asked Dr. Happ and Jed last week, give us a definition of a mask or a face covering. And they said it has to have 3 things. You've got to have 3 criteria. It has to cover your nose, it has to cover your mouth, and it has to fit snugly, it has to fit tightly. You know, it can't just be hanging and loose. And they said, in addition to that, it could be one of those surgical masks that we all see. You know, they're cheap, like $20 for a box of 50 or whatever. And that's acceptable, but also acceptable are those neck gaiters, you know, those stretchy, tight-fitting neck gaiters. And it's interesting because when you put those neck gaiters up against your face, you can see through them, you know. And we know the virus is very, very small and can go through there, but the importance of wearing a mask is if I am asymptomatic and I cough or sneeze, that is a barrier to help reduce the spread of the virus. So it's not a cure-all, and we know that. we know that a mask isn't going to stop the spread, but that's why we're taking all these other precautions. We have cleaning precautions. We got the physical distancing precautions. We got the mask precautions. Some of our teachers may likely have to wear a face shield or goggles on top of that. So it's all of these steps that we're putting into place in order to make school the safest learning environment we possibly can, knowing that there's no guarantees with anything. And we talk a lot about this risk versus benefit. I get out of bed in the morning, I'm taking a risk with my life, really. I drive down the highway to try to get to work. There's a risk. And we know that with anything as well as with COVID-19, there are risks with anytime we leave the house. It's just making the most educated choices that we can to try to reduce that spread. Knowing that maybe all of us will get it sooner or later. I don't know. Hopefully we just can reduce that spread.
I know when you're considering all this sort of stuff, whether it's an ordinance or how school's going to be run or how businesses run, I know, Aaron, one of the things you want to speak on a bit is compromise. I mean, there's so many factors, so many people involved. I know a lot of people are, very emotional about what's going on with all this, and there's a place in the middle where this can all work out.
Yeah, thanks, Josh. I think the question of what does leadership look like, it comes up a lot, and I know it's a question that I've heard the last couple of weeks. And leadership, the reality looks different to different people, right? Leadership, depending on what your thoughts are and how you feel on certain things, looks different. And to me, I just wanted to talk about what leadership has looked like and what I've seen in the past 3 to 4 to 5 months. And to me, I think a lot of people's frustrations is the lack of ability to work together and come together, not only in the last 3 or 4 or 5 months, but the last, I don't know, it's kind of just gotten more like that over the course of time, right? And what I have seen here at the city level is with our staff and with our council, we have gone through, just like the school has, just like businesses have, we have gone through some changes that you would never have expected that we would have had to go through, from shutting down to remote work to making our employees wear masks, to requiring other people to wear masks, to now having a conversation around mask ordinances and what that looks like. And the thing I've been most impressed with, and what I think has been a show of leadership, is the ability to have conversations, even when our opinions don't always align, and to be able to have those conversations professionally and to keep things moving in a positive direction. And I have been really blessed to be a part of a team from both our elected officials level and our staff's level that have been able to do that on a day in and day out basis. And that shouldn't be taken for granted, because there's been a lot of changes that could lead to that not being the case. So, I think I just look forward to continuing to work in those parameters. And to me, that's what leadership looks like. And really it comes down to listening, understanding other people's opinions and values, and understanding that we don't have all the answers as individuals. And that's, I guess I just wanted to touch on that. So thanks. And I also want to say, if you saw some bobbing heads in the background or floating heads, we're trying to balance childcare with work. Me and my wife.
You helping you out this week.
Yeah, I saw some balloons in this background here. We're on a mandated quarantine right now because of an exposure to my daughter. And I do want to say that it was at a daycare facility in town. The daycare facility has been fantastic. Great communication. Public health has been fantastic. So anyway, that's, if you're wondering why the heck I got little kids running around, that's why.
Hey, Aaron, I just want to say, what you just, the second to last thing you stated about the leadership piece and the fact that we don't know it all about what we're experiencing and everything of it. I just want to give you a compliment for the level of, your leadership with the city and the city council, and your ability, because we all have egos in leadership, but your ability to stay humble and to listen to everybody in all perspectives and know that we don't know everything and we've got a lot to learn, and to value everybody's opinion. One of the attorneys that I was talking to in a conference call yesterday said, wherever a person is on the spectrum in regards to these topics, these controversial topics like masks or no masks or whatever, we can find, this is one of the premier attorneys in our state, educational attorneys, he said, you can find the science to back your political position because there is that science on both sides. Now, some people disagree with that. But I'm humbled enough to say that really struck me. And it really forces, as we talk about this with our community and our staff and our children, when the kids are coming back to school, to have respect for people wherever they land on this. I mean, obviously at school, we're going to have to wear masks. And that's a good thing. At the same time, there's going to be people not wearing masks. And at the same time, in the community or other communities, you're going to see people with masks or without masks. And to have respect for people on those choices. And I don't want to judge them just because I may have my own personal opinion, and moving that aside, that's how it's supposed to work in our country, at least from my perspective, in creating that level of civility and mutual respect, like you said, is the real true leadership, instead of shoving my personal agenda down somebody else's throat. So I just want to compliment you on that. You're doing a great job. I'm learning from you every day, Aaron. Well,
Ron, I said this to someone last week. You are very good at giving compliments, and you know what? You deserve many yourself. I have thought throughout this time, I don't even know how you begin to try to wrap your head around starting school. And I know that there are so many what ifs that you guys have to go through in your team. And if you were not a great listener, which I know you are, because I've worked with you more than enough in the last couple months, there's no way you can navigate that. And I think that I give you and your team so much credit for that. And I'm glad that I have kids in our school district, and I'm glad that the people that are working at the top and the teachers and from the top down are there, because I think it's in good hands. So.
Well, the other thing is, as we work so much together on so many projects, Aaron, with the two of us, along with Terry from the chamber, and the great team we have, and knowing what Noah Lemke's doing as we work with him with our marketing, we should maybe possibly step away from COVID next week, Josh, and talk about the collaboration that we're doing and the progress that we're making with our marketing of our community, with all the great things going on. I mean, yeah, we're struggling with COVID and learning in 2021 and the city with the masks and everything, but there's a lot of great work going on behind the scenes at the same time as this is all going. And I think the community would be very excited to learn more about our marketing and collaborative efforts too.
I think so too. I think that's a great idea. Shift gears a little bit, talk about what's going on in the future. I think all of us are up for that. So.
Well, Ron, Aaron, thanks for the update and kind of just the words of encouragement you provided about, working together and being civil about everything, and, what we don't know, and we got to figure out how to move forward here. So thanks.
You're welcome.
Thanks, Josh.